Welcome to the deep dive. Today we're plunging into a term that, well, might initially sound like it's straight out of a complex medical textbook: lymphopenia.
Yeah, it does sound a bit technical, doesn't it?
It really does. But don't let the name intimidate you. This isn't just dry science. It's actually a surprisingly profound indicator, a secret language, if you will, that tells us what's truly happening inside an animal's body, especially when we're talking about our equine friends.
It's true. And while it sounds highly specialized, understanding lymphopenia actually gives us a powerful shortcut. We've taken your sources, packed with, detailed information on this condition, and we're going to extract the most important insights for you.
Sort of the aha moment.
Exactly. The surprising facts that will really help you grasp what's going on.
Okay, so let's cut to the chase then. What is lymphopenia?
At its core, it's pretty straightforward. It's a decrease in the absolute number of lymphocytes circulating in the blood.
Lymphocytes.
Oh, yeah.
Right, remind us they're like the immune system's elite cavalry.
That's a great way to put it. They're out there patrolling, ready to recognize and eliminate anything that shouldn't be there. Pathogens, abnormal cells, the works.
So lymphopenia means that cavalry regiment is suddenly much, much smaller than it should be, like below a certain threshold.
Precisely. Typically below 1,500 cells per microliter. And that low count is a critical red flag.
A red flag because...
Because it tells us that the body's immune response might be impaired, which directly translates to an increased susceptibility to infection. It's like discovering your frontline defenses are, significantly depleted.
Okay, let's unpack this then. We've established that these lymphocytes are crucial, but before we get into what makes their numbers drop, maybe give us a clearer picture of how these cellular warriors actually operate.
Sure. So these immune system cavalry members, as you aptly put it, are primarily produced in specialized lymphoid organs all over the body. Places like the thymus, the bone marrow, lymph nodes, the spleen.
Okay, the production centers.
Right. But what's fascinating here is that their numbers in the blood are never static. They represent a very dynamic balance.
A dynamic balance, meaning...
Meaning it's a constant ebb and flow between how many are being produced, how many are released into circulation, how they recirculate through the body, how many get destroyed, and even how many temporarily, stick themselves to the walls of blood vessels.
So they step out of the main flow for a bit.
Exactly. They might just adhere to the vessel walls for a moment.
So it's not just a fixed count you get on a lab report. This number is a living, breathing reflection of an ongoing cellular ballet, constantly shifting.
Absolutely. The real insight here is that a single blood test is just a fleeting snapshot in time. Understanding that fluidity is absolutely key to interpreting what a low count truly means for your horse.
Right. Knowing how these cells are constantly in motion, what kind of pressures or problems could cause their numbers to dip below that crucial threshold? What are the most common culprits we see in horses?
Well, what's fascinating here is that often the most frequent cause in horses isn't, say, a direct infection itself, but something we call corticosteroid-induced lymphopenia.
Corticosteroid-induced.
Yeah. We often see this as part of what veterinarians term a stress leukogram.
A stress leukogram. Okay, that sounds like the body is literally stressed out. How does that impact the cavalry?
Exactly right. It's the body's natural response to stress. And in horses, stress can be anything from pain, inflammation, illness, fear, anxiety, even really intense exercise.
Okay.
So when a horse is stressed, its body releases endogenous corticosteroids. These are its natural stress hormones. And exogenous corticosteroids, like medications such as dexamethasone or prednisolone, they act in a very similar way. They predictably induce lymphopenia.
How? What's the mechanism?
They cause a significant redistribution of lymphocytes, primarily the T cells. So instead of circulating freely in the blood, they essentially retreat.
Retreat where?
They temporarily move back into lymphoid tissues or even the bone marrow. It's like they're taking a strategic pause, kind of going off duty for a bit.
Wow, so they're not destroyed. They're literally just strategically moving. That's actually quite clever of the body. I never thought of it that way.
It is, in a sense.
So if they're just hiding, does that mean it's not a cause for serious alarm, or is there still a risk involved even if the cells aren't destroyed?
Well, for the most part, it's a temporary, transient shift, and often not a cause for serious alarm if the stress is acute and resolves quickly.
Okay.
However, prolonged high doses of corticosteroids can, in some cases, cause actual lympholysis. That's the destruction of certain immature lymphocytes, particularly in the thymus and lymph nodes. But it's important to remember that the mature, ready-for-battle B and T cells, they're generally resistant to this specific destructive effect from steroids.
That's a crucial distinction. Okay, so beyond stress, What else can cause this dip in lymphocytes? Where else might the cavalry be thin?
Acute systemic inflammation and infection are major players too.
Right.
Right, during severe acute inflammatory conditions, especially those involving endotoxemia.
Endotoxemia. That's when bacterial toxins cause a massive body-wide inflammation.
Exactly. Things like severe colic, colitis, pneumonia, peritonitis. In those situations, lymphocytes actively migrate out of circulation and into the affected tissues or lymphoid organs,
Ah, so they're rushing to the front lines.
literally rushing to where they're most needed to fight off the problem. This rapid shift leads to transient lymphopenia. And sometimes, in really overwhelming infections, you can also see outright lymphocyte destruction.
Which infections are the most notorious for causing this and why? Are there any patterns we see?
Absolutely. We see it with various viral infections like equine influenza, equine herpes virus, even EIA in its acute phase, or equine viral arteritis.
Okay. Viruses?
And common bacterial diseases too. Bacteremia, bacteria in the blood peritonitis, pleuropneumonia, even specific culprits like the agent behind Potomac horse fever, Nerickettsia rickettsia, or protozoal infections causing equine pyroplasmosis like Theileria or Babesia.
So quite a list.
Yeah, the common thread is a widespread acute inflammatory response that just calls these cells out of circulation or, sadly, leads to their destruction.
We've talked about these cells getting redistributed or rushing to the fight. But what if the very factory producing them is compromised? Or when the cells themselves are outright destroyed? That sounds like a much deeper problem.
Indeed. And this brings us to some of the more serious underlying issues. First, there are primary immunodeficiencies. These are rare genetic conditions where lymphocyte development itself is inherently impaired.
Genetica.
The most well-known example in Arabian foals is severe combined immunodeficiency, or SCID.
Yes, CID, right. I've heard of that.
It's a fatal genetic disorder. Essentially, there's a severe deficiency or even complete absence of functional B and T lymphocytes. This leads to profound and persistent lymphopenia. Without these cells, the foal simply cannot mount an effective immune response.
So a horse might look fine initially, but if the factory shut down, they're sitting ducks.
Precisely. Bone marrow suppression is another key mechanism here.
How does that happen?
Severe conditions that affect the bone marrow, things like aplastic anemia, certain toxicities, or even some chemotherapeutic agents like azathioprine or cyclophosphamide, they can significantly reduce overall lymphocyte production because, well, the factory is damaged.
Makes sense.
And beyond production, conditions like severe viral infections, radiation therapy, and even some forms of lymphoma can lead to lymphoid tissue atrophy or destruction. The places where lymphocytes live and mature get damaged.
And are there any nutritional links or even cases where the body just loses these critical cells?
Yes, although these are generally less common. Nutritional deficiencies, specifically copper and vitamin A, can play a role. We've also seen iron toxicity linked to lymphoid necrosis, and severe protein-calorie malnutrition can induce T-cell lymphopenia, though surprisingly, B lymphocyte function seems largely unaffected in that case.
Interesting distinction. An actual loss.
It's rare in horses, but it can happen. Conditions like chylothorax, where lymphocyte-rich lymphatic fluid is lost into the chest cavity, or lymphangiectasia, often part of a protein-losing enteropathy, where lymphocytes leak into the gastrointestinal tract.
What about cancers like lymphoma? Wait, I thought cancer usually increased white blood cells. How does lymphopenia fit into that? That feels like a paradox.
You're absolutely right. It often is a paradox. Lymphoma or leukemia typically lead to lymphocytosis, an increase in lymphocytes.
Right.
However, some really aggressive or widespread forms of these cancers can paradoxically present with lymphopenia. Well, maybe if they severely infiltrate or overwhelm the bone marrow's ability to produce any cells, or if the cancer itself consumes lymphocytes faster than they can be produced. It can also be seen in the later, more advanced stages of some chronic lymphoid malignancies. It's usually a very worrying sign when you see lymphopenia with lymphoma.
Okay, so we've got a whole rogues gallery of causes here. Stress, infection, production failures, loss, even cancer sometimes. Now, how do we, as careful observers of our horses or the vets, actually detect this decrease and then, perhaps even more importantly, pinpoint the specific culprit?
The starting point always is a complete blood count, or CBC.
The standard blood test.
Exactly. The absolute lymphocyte count is the primary diagnostic finding. If that number is below the lab's reference range, typically under that 1,500 cells per microliter mark we mentioned, then lymphopenia is present. A manual review of the blood smear by a pathologist is also really important to confirm automated counts and look for other changes.
Does the severity of the lymphopenia tell us anything? I imagine a tiny dip versus a massive drop means very different things.
Absolutely. The degree of lymphopenia provides crucial clues. Profound lymphopenia, we're talking, for instance, below 1,000 cells per microliter, or even below 500 cells per microliter in horses, that's a significant indicator.
Really low numbers.
Yeah. It's highly suggestive of either severe stress, an acute, overwhelming inflammation or infection, or a primary immunodeficiency like SCID or maybe common variable immunodeficiency. The lower that number goes, the more urgent the investigation becomes.
And what else on that lab report should we be zeroing in on? Things that scream stress versus infection versus bone marrow trouble. How do all the pieces of the puzzle fit together on that CBC?
Great question. We look at associated CBC findings for a complete picture. For example, if you see concurrent neutrophilia, that's an increase in mature neutrophils and eosinopenia, a decrease in eosinophils.
Neutrophils up, eosinophils down.
Exactly. That pattern very strongly suggests endogenous stress, the horse's own cortisol or exogenous corticosteroid administration like medication.
Okay, the classic stress pattern.
Right. Now, if we see neutropenia or neutrophilia along with increased band neutrophils, those are the immature ones, and maybe toxic changes in the neutrophils themselves, plus elevated acute phase proteins like fibrinogen or serum amyloid A.
That sounds like infection territory.
Highly consistent with a severe acute infection. It shows the bone marrow is pumping out neutrophils, even immature ones, to fight something big.
And bone marrow problems.
We always check for concurrent anemia, low red cells, or thrombocytopenia, low platelets. If the lymphopenia is accompanied by other cytopenias, it points directly towards bone marrow suppression, hinting at a much more widespread production problem.
So what does this all mean? It means the CBC is like our first detective tool, giving us a ton of clues. But when the CBC gives us clues but not the full answer, what's next in the diagnostic toolkit?
That's when we branch out to more specialized tests. For instance, those acute phase proteins we mentioned, fibrinogen and serum amyloid A or SAA, elevated levels are clear indicators of systemic inflammation, helping us confirm the body is indeed fighting something serious.
Confirming inflammation. Got it.
We can also do endocrine testing. Basal cortisol levels can confirm if a stress response is contributing to the lymphopenia. And checking ACTH levels might be relevant, especially if we suspect something like PPID, which causes chronic cortisol elevation.
And if we're really honing in on an infection, what's the go-to?
Then specific infection tests are key. Things like PCR or serology for suspected viral infections, EHV, EIAV, EVA, influenza, and so on.
Testing for the specific bug.
Exactly. And for foals, if lymphopenia is a concern, immunoglobulin quantification, often using RID, is essential. This helps rule out failure of passive transfer, meaning they didn't get enough antibodies from mom's colostrum, which is crucial in their first few days, and it can point towards other immunodeficiencies too.
And for SCID?
For Arabian foals where SCID is suspected, flow cytometry is the diagnostic test. It actually subtypes the lymphocytes, counts the different kinds, B cells, CD4 plus T cells, CD8 plus T cells. In SCID, it shows the telltale absence of both B and T cells. It's definitive proof.
That's very specific. And what if it's something internal we can't see on blood work? How do we take that diagnostic deep dive into the horse itself?
Right. That's where imaging and biopsies come in. Ultrasonography or radiography, x-rays of the chest or abdomen can be very helpful.
Looking inside.
Yeah. Or procedures like abdominocentesis, taking fluid from the belly, thoracocentesis from the chest, maybe collecting cerebrospinal fluid, or doing blood cultures. These become crucial if an infectious disease is suspected in a specific body cavity.
And if bone marrow suppression is the main concern?
Then a bone marrow aspirate or biopsy is performed. We go right to the source to examine the factory directly.
Makes sense. And for those gut issues?
For conditions like protein-losing enteropathy, an intestinal biopsy might be necessary to confirm the leakage and the underlying cause.
Okay, so we've gone from a single number on a blood test to potentially quite a detailed diagnostic picture. Now, the million-dollar question: how do we fix lymphopenia, and what's the prognosis for our equine friends?
Well, the guiding principle is absolutely critical here. Treatment for lymphopenia is always directed at the underlying cause, not the lymphopenia itself.
Or because it's a symptom.
Exactly. Remember, lymphopenia is a lab finding. It's a sign, not the disease.
That makes perfect sense. Just like you wouldn't just treat a fever without knowing what's causing it. So what are the different treatment approaches depending on the cause?
Okay, so for corticosteroid-induced lymphopenia, the kind from stress or medication, often no specific treatment is required for the lymphopenia itself. It's usually transient and typically resolves within, say, 24 hours of the corticosteroid exposure ending or when the underlying stress resolves.
So time and removing the stressor.
Pretty much.
Hmm.
Now, for acute infections or inflammation, obviously medical treatment is required until the underlying condition is stabilized. If it's a bacterial infection, that means appropriate antimicrobial therapy, ideally based on culture and sensitivity testing.
Targeting the bacteria.
Right. And managing pain, treating the primary infection, minimizing any additional stressors, these are all key to allowing those lymphocytes to return to normal circulation.
And if it's drug-induced, say from necessary medications like steroids for another condition,
Yeah, if iatrogenic corticosteroid administration is the cause, the approach is usually to gradually reduce or discontinue the drug, but only if that's clinically appropriate for the horse's other condition. You have to weigh the risks and benefits.
tricky balance sometimes.
It can be. For bone marrow suppression from something like chemotherapy, you need to remove the causative agents if possible and provide really aggressive supportive care. This might include blood transfusions, broad-spectrum antibiotics to prevent potentially devastating secondary infections while the bone marrow recovers.
What about those very serious immunodeficiencies you mentioned earlier, like SCID, or problems in foals like FPT?
For failure of passive transfer, FPT, in foals, an intravenous plasma transfusion is the treatment giving them the antibodies they need. That's often life-saving.
Crucial.
Absolutely. However, for SCID, there is unfortunately no effective treatment currently, and the prognosis is grave. It's invariably fatal. Prevention through genetic testing in susceptible breeds like Arabians is really the only approach there.
So sad, but important to know.
Definitely. For other causes, like viral infections, supportive care is often the main strategy, allowing the horse's own immune system time and support to recover. And for protein-losing enteropathy, the focus is squarely on treating the underlying intestinal disease causing the protein and lymphocyte loss.
Beyond these direct treatments, what kind of general supportive care is important for a horse with low cavalry numbers?
Or
It's vulnerable, right?
extremely vulnerable. So strict biosecurity is paramount, especially for severely lymphopenic or immunocompromised individuals. You have to minimize their exposure to any potential pathogen
Protect them from everything.
as much as possible. You're trying to reduce the burden on an already weakened immune system. Judicious use of prophylactic antibiotics might be considered in very high-risk cases, but always with extreme caution due to the risk of developing antibiotic resistance.
Good point.
And, of course, ensuring adequate nutritional support is vital for overall immune function and recovery. The body needs fuel to rebuild and fight.
All right, so what's the prognosis? We've heard some grim possibilities, but does having lymphopenia mean a horse is always in serious trouble?
Not at all. The prognosis for lymphopenia is entirely dependent on its underlying cause, as well as the severity and duration of the lymphocyte decrease. It's really important to remember that a single low count isn't necessarily a death sentence.
Okay, that's reassuring. So there's good news, and then, of course, the red flags we need to watch for.
Exactly. For physiological lymphopenia, the kind that's often just a transient response to acute stress, the prognosis is excellent. It usually resolves spontaneously.
Good.
The same generally goes for corticosteroid-induced lymphopenia. It resolves quickly once the stress or steroid administration stops. And mild to moderate lymphopenia, secondary to an acute resolving inflammation, also usually carries a good prognosis. The lymphocyte counts typically rebound as the horse recovers from whatever caused the inflammation.
But then there are those undeniable red flags.
Mm-hmm.
When should we be really worried?
Yes. Profound and persistent lymphopenia is a significant red flag. This category includes those primary immunodeficiencies like SCID, which, as we said, is invariably fatal.
Right.
Severe, overwhelming acute infections also fall into this guarded to poor prognosis category, especially if there's endotoxemia involved. Bone marrow suppression has a variable prognosis. It really depends on the cause and whether it's reversible.
And cancer.
And certain aggressive neoplasms, like some lymphomas or leukemias, often have a poor prognosis anyway, and seeing lymphopenia in these cases can be a very negative prognostic indicator. It often points to a really deep systemic issue that's hard to overcome.
So the reversibility of the cause is absolutely key, and the complete blood picture, looking at all the cell types, tells the biggest story.
Absolutely. The prognosis is heavily influenced by whether the underlying cause can be identified and effectively treated or removed. The degree and duration of the lymphopenia also play a big role. More severe and persistent lymphopenia is generally much more
Any
concerning.
other cell lines?
And finally, yes, the presence of concurrent cytopenias, meaning if lymphopenia is accompanied by anemia, neutropenia, or thrombocytopenia, that suggests widespread bone marrow involvement and signals a much more serious outlook for the horse. It tells you the problem isn't just with lymphocytes.
As we wrap up this deep dive, it's really clear that lymphopenia, this seemingly small change in a cell count, can reveal such profound stories about an individual's health and resilience. It really is like a powerful whisper from the body if we only know how to listen. What stands out to you about how understanding this dynamic interplay of cells empowers us to think differently about health and disease?
You know, it truly highlights the body's incredible complexity and its constant balancing act. Lymphopenia, while it's a specific finding on a blood test, reminds us that the health of an entire organism can be reflected in the smallest cellular details, like the number of our immune cavalry, as you called them.
Yeah.
And it underscores that quick, accurate diagnosis isn't just about finding a name for a problem. It's the absolutely essential first step towards guiding that horse back towards health, towards recovery, and ultimately towards resilience. It's about understanding the why behind the number.